Welcome to the aligned grad gait video. Now my plan for this video is to make it the most efficient gait tutorial you've watched, and I plan on doing that by including some of the more important clinical sorts of information when it comes to gait and testable information. Now, I'm going to do that by breaking down each of the individual phases of gait. That'll be the first step. Second step, have a self-guided pause when you want, test yourself moment in the video. And then I'll finish off by sharing with you a study guide that really includes some of the more important information when it comes to gait. So really summarizing what it is we talk about. So let's get into it. Let's look at one of the gait cycles, and this is actually 2 gait cycles for the right leg. Now I say the right leg because each gait cycle is in reference to one leg, not both. That's important to remember because technically there is a gait cycle. Although we're going to be looking at the right leg, there will be a gait cycle going on the left leg too. That's just not what we're focusing on. A gait cycle is looking at one leg at a time. So let's go ahead and highlight this right leg, and let's take a look at the cycle going through. With it highlighted makes it a bit easier. One more time here, good. Now let's get into the first phase, that is heel strike. Now heel strike is the first phase of stance phase. So we have 2 phases within the gait cycle, and that's stance and swing phase. There's 5 stages of stance phase, 3 in swing phase, and these photos make it a little bit difficult to understand, like, is the foot on the ground or not? Just know that if you're in stance phase, the reference leg is on the ground, okay? So if we're in the stance phase still, the leg is on the ground. The opposite can be said for swing phase, but we'll get into that when we get to it. So the 3 things I'm going to include, really 2 things I'm going to include on each slide that I think is important, and we'll kind of cruise through this pretty quickly, is the muscles responsible and the angle that we can expect at the hip, knee, and ankle, right? So here in heel strike, the muscles that are important are our hip extensors and our dorsiflexors, but not necessarily in the way you think when, most people think the squeezing of a muscle when it comes to it being important for something. But in heel strike, the hip extensors are actually trying to slow down that forward propulsion of the leg that's happening moments before heel strike. We'll get into that with terminal swing phase. They're very alike because this is at the start, the terminal's at the end, and so they have similar functions, but that glute is really responsible for slowing down that leg movement. Similar thing is happening with the dorsiflexors, as you can see. The arrows, and so by the way, the arrows pointing away from each other means eccentric control. When they're pointing towards each other, it's going to mean concentric control. So we have here the dorsiflexors are really controlling the lengthening, and that makes sense when we get into the next phase here. Also take a peek, the hip is at 20 degrees in heel strike. So let's take a look here. This goes from heel strike to the next phase. So we just went over heel strike here. The next phase is happening here. And so I really want you to take a peek at the quadriceps and the ankle plantar flexing. So we can see that the quad is likely lengthening because the knee is bending, and the dorsiflexors are likely lengthening because we are going into plantar flexion. Now, when we think of plantar flexion, it's easy to think, okay, gastric knee, medius soleus, that's what's responsible. Here, in loading response, so let's take a peek at that. Here in loading response, the plantar flexion is actually achieved by the lengthening, the controlled lengthening, the eccentric movement of the dorsiflexors. Similar things happening in the quad, that is slowly lengthening, and that is what's controlling the weight acceptance. Imagine if we didn't have this quadricep control, your knee might just buckle, right? You wouldn't have those quads really slowing down the lengthening of the knee there. So that's what's important in loading response. It's a really important phase because it's what's allowing our weight to be kind of put into this foundational position. So the angles here, and these are going to become more important when we look at the study guide, because you can kind of almost observe a pattern with the angles. So don't worry so much about them yet, but just know 20, 20, 10 in terms of hip, knee, and ankle angle. All right, so that was loading phase. What is the next phase? Well, we're really propelling the weight forward. So some of the things I want you to really pay attention to here are the hip in loading response versus the hip in this next phase here, which is mid stance. So we're really getting hip extension. We're also getting knee extension here, so that you can imagine then that might be part of it. We're also going into dorsiflexion. So, just imagine then what it is that is responsible for that. Well, let's take a look. As we probably could have imagined, the hip extensors are really what's propelling that weight forward. The dorsiflexors of the ankle are also responsible for that. That's what's kind of anchoring, getting that tibial advancement to take place. And you can see we go from plantar flexion to 5 degrees of dorsiflexion, which makes sense. That's what's allowing that ankle to propel forward. Similar with the quads, we went from knee flexed or knee extended. And so the center of gravity is really stacked on top of each other. And that's because of this concentric movement between the hip extensors, the quadriceps, and the dorsiflexors. From mid stance, you'll see that the weight is kind of falling forward. So one of the things I want you to see is that reference leg is fully extending, right? And we can see we're beginning to get into plantar flexion here. So what phase is this? Well, this next phase of gait is really important, and it's really important because you can see from here to here that the weight is really beginning to propel forward. What is happening here to prevent that weight from just falling over, right? And of course, our other leg is there to catch us, but the reference leg is doing something important too, and that is using our deep plantar flexors to slowly, eccentrically slow that leg down, so that heel strike on the other side isn't so abrupt, isn't so hard on our body. And so you can also see that those foot flexors are really sort of locking down as well. So I think most importantly in this stage is what's happening at the level of the plantar flexors, which is slow eccentric movement. So that is terminal stance. And I had made it so pre-swing is the same photo, because really pre-swing is what's happening to prepare us for the next phase. But there is quite a bit of muscle action that's happening here. It's toning, almost in preparation for the next step of gait. So again, angles, don't really be too concerned about this, but one of the pivotal moments in pre-swing is the fact that this is the last phase of stance phase. So remember, I said stance phase. If we're in stance phase, it means that reference leg, in this case the right leg, is in contact with the ground. Well, this is going to be the last phase of gait that this reference leg is on the ground. So bye-bye to the ground. So we're in pre-swing. We're going from pre-swing to initial swing. Right. And so what happens here, we go from pre to that, right? And so, that although we're not looking at the other leg, it's important to take a look at it because, and we'll get into that in a second, but what are the muscles responsible for this? Well, it makes sense that from here to here, we're really seeing some hip flexion. We're seeing some knee flexion. Okay. And that makes sense. Look at the muscles here. So we have some concentric hip flexion, concentric hip, concentric knee flexion, same with dorsiflexion, and the knee flexion and dorsiflexion is really happening to clear that foot over the ground, right? So that's the first phase of the swing phase. We go from that to mid-swing, and again, pretty straightforward. We got that hip flexor action. We also have our quads starting to extend the knee. And remember, heel strike, what our foot looked like. This is the beginning of kind of setting up that stance for heel strike. We're really starting to lock those quads down, and dorsiflexors are starting to engage to allow for that neutral ankle that we like to see in heel strike. Cool. So we go from mid swing. That was mid swing. We go from that to terminal swing, and that's what we're seeing here. That knee continues to extend. The dorsiflexors are continuing to dorsiflex, and we can see that here. That is, although that's true, we just talked about how the quads are continuing to lock down to extend the knee, similar with the dorsiflexors. That's not what I'd like to focus on in this step, terminal swing, the last stage, not only of the swing phase, but of all of gait. It is actually the lengthening, the controlled eccentric movement of our hip extensors and our hamstrings. That's, again, like what we talked about in heel strike, really slowing down. So we're really controlling that first phase of gait. So let's take a little moment to kind of quiz yourself on what we just talked. All right, so I want this to be the quiz portion of the video. So I am going to tell you and show you on the screen, but I want you to kind of try to predict what I'm about to say or what I'm about to reveal in the video. So let's take a look at this phase here. Now, from what we've looked at, and let's assume now that they're at the beginning of the phase of gait here, of the gait cycle. So this is definitely heel strike. Now, you can kind of pause and do whatever you need to here, but I want you to predict what the next phase is. This is loading response. Okay, so I want you to imagine now what's next, what's coming next. The phase actually looks like this. So what is this phase? I also want you to know too, and remember that, these phases of gait are just snapshots in time, and real gait is a lot more fluid, a lot more dynamic, and ultimately it's hard to capture that in this sort of format that I wanted to do for this video. So, take a look at other people's gait. Take a video of yourself walking. But let's go to the next one. All right, the next one's going to look something like this. What are we going to call this? That's terminal stance. All right, and pre-swing is next, and it looks, identical. I used the same photo. Truly, they are different moments in time, but for the sake of this video, just, it's important that you know what's going on in pre-swing, not so much what it looks like, but like I said, look at yourself and other people walking, and you can kind of imagine it from there. So after pre-swing, we have this, and what are we going to call this? Well, this is the initial swing. The swings are easy because they kind of are what they sound like, right? So this is the next phase here, and of course this is mid-swing. That's mid-swing, and then the next step looks like that. And we're calling this, although this is the same photo as heel strike, we're calling this terminal swing. And of course, just remember that the foot hasn't quite reached the ground in this phase. So just know that. All right, so let's look at the study guide next. All right, so this is really the important part of this video here is the study guide. So I'm not going to read all this. I want you to take a look at each of the color-coded steps that compare to or that are associated with each of the phases of gait. Take a look at the main objectives. We kind of touched on some of them, but this will be a little bit easier for you to study. I also want to make it clear that you should take a peek at the angles, and this is what's going to matter clinically as likely how you're going to, these angles are going to manifest themselves is you're going to hook your patients up to some sort of software where you can see the angles that their hip, knee, and ankle are showing. And so I want you to look at, okay, is the angle that they're showing higher or less than what we can expect, what we see in these numbers, and use the common sense approach that if the angle is higher, well, what muscle would be responsible for creating a higher angle in the hip or knee or ankle. So in the case of heel strike, for example, if they have a angle lower than 20 degrees, well, do we have some sort of hip flexor compromise or weakness? Look into that. That's the functional way to look at these things. Same with knee flexion in loading response. Say they have less knee flexion. That might mean that there's less eccentric ability of the quadriceps muscles, right? And so take a look at that clinically. So kind of the common sense approach when it comes to the angles. Similar thing with the muscles, is it eccentric? Is that particular phase of gait where they might experience pain an eccentric responsibility of that muscle or a concentric? So knowing the eccentric or concentric primary objective of that muscle in that particular phase of gait is important in understanding how you can best serve your patient. I have a similar thing for the swing phase, and the same logic applies. So that is the gait video. I hope you enjoyed, and we'll see you next time.